I am joined by Dr. David Dangerfield. We are discussing new procedure, nerve grafting surgery to restore erections for men who are post-prostatectomy. So Dr. Dangerfield, if somebody was interested in nerve grafting surgery, does that then limit them from proceeding with other procedures afterwards, such as, for example, the penile prosthesis, or even actually other treatments that may come up for a recurrence of cancer?
Good question. Not at all. Patients can go on, if they don't get the success with nerve grafting, they can go on to a penile prosthesis without any issues at all. There's minimal scarring in the area, and that's not an issue.
Are there any side effects that men should be aware of when it comes to the nerve grafting procedure?
Yes, certainly. There's a reliable side effect of secondary to taking out the sural nerves, and the sural nerves supply sensation to the side of the foot, the side of the ankle. So it's very common and a predictable side effect is to get a numb area on the side of the foot, but that doesn't really bother most guys. We've had a couple of marathon runners who noticed it for a while, but then they got over it as well. The sural nerve is a sensory nerve only, so the motor function of your legs, the muscles and the way you walk is not impacted long term at all.
Fantastic. It sounds like then there's actually minimal side effects.
Minimal side effects because we're using the sural nerve. While we're mobilizing the femoral nerve, you can get some bruising in the femoral nerve, so you can have some short-term weakness in your quadriceps muscles, but certainly nothing permanent there. But it can be a little bit unpredictable in the first week or two before it settles down.
Okay. Now, when somebody was preparing for this surgery,
Yes.
is there any sort of prehabilitation that you recommend they do? What would preparation look like before this?
It's usually quite straightforward, and you're in hospital only for a night. We like smaller patients. We've noticed that over time. Guys with a lot of weight don't do as well because it's quite meticulous, fine surgery, and to be doing it down a deeper incision, I think has an impact on the success of the procedure. So we like guys with a BMI, around 25, certainly not over 30. That's an important factor now. So, yeah, to lose weight potentially if you need to helps.
Okay. And in terms of rehabilitation, once they've done the procedure, what do you recommend with that?
Yes, certainly. So we go back to all the techniques they were using beforehand. So once you've recovered from the procedure, usually 2 or 3 months down the track, back to the vacuum devices, back to the medications. I hold off on the injections again, usually closer to 12 months if there's still issues there. But no, going back to all the common forms of rehabilitation, well and truly.
And do you ask men to avoid the injections more as a way of encouraging them to use the medication so that they can see if the nerves are coming online? Because, of course, the injections bypass.
That's right.
The whole process.
That's right. And it can be a demotivating factor because they can get frustrated and then just go back to the injections, which are a more predictable response.
Because a lot of men listening to this would be hearing that it's at that 2-year mark that you recommend that they could look into this.
Yes.
Do you find that men who have been doing a lot of penile rehabilitation up to that point but aren't seeing success, do they end up having, would you say, better success rates because they have that history of doing rehabilitation? Or have you not seen a difference?
Yeah, no, it helps. It does. It does help. We're putting those figures together now. So you want to make the most of your nerve sparing. But if you haven't got a response usually by 2 years, that's when you qualify for our procedure. If you've had a non-nerve sparing procedure, we'll do you straight away because the chances of responding or rehabilitating spontaneously after a non-nerve sparing procedure are very low. So we'll operate on those guys within 6 months of their radical prostatectomy. And I think we're getting good results there because we're operating on them earlier and they're keeping away from corporal scarring as well, which is a factor. The longer you go, usually it's not always predictable, but the longer you go post-radical prostatectomy, not having your nocturnal erections, not getting oxygenated blood through the area, the more you're likely to scar. And because of that, that's why we're seeing better results in the non-nerve sparing group because we're getting to them earlier.
And that's, again, why penile rehabilitation is important. Even if you feel you're not getting any natural response, it's still important because that daily activity is keeping that penile tissue in good condition so that down the line you can have a procedure such as this one and hopefully get good results from
Very
that.
much so, Victoria.
Yeah.
Yep.
I'd love a reminder as well. We have this in the last video, but the success rates for this procedure.
So the success rates are around about 65%, and that more applies to nerve-sparing patients. And the non-nerve sparing patients are around about 55%.
Fantastic. Now, if somebody would like to go ahead and learn more about this procedure, potentially even have it themselves, what would the next steps be for them to take?
The next step would be to contact My Rooms, Complete Urology Care, and we send out all the information and potentially make a time for an appointment.
Fantastic. We'll make sure that the details for that are in the description box below so people can reach out if they want to. Thank you very much for your time.
Thanks, Victoria.